The chair recognizes the honourable member for Kalani.
Thank you very much, Madam Speaker. Madam Speaker, at first I'd like to thank the member for Long Island who has yielded to allow me to speak, knowing that I have to leave soon to do my daily chores pickup. But Madam Speaker, before I get into debate, I want to remind all in here and in Parliament that Monday is Gambia Day, where Gambia have their usual activities, festival, all day food, there's entertainment, live music. It's in Gambia Village. And we're talking sense. Gambia Village in the great constituency of Kalani. And Madam Speaker, the festival or the activity will conclude with the members of the Saxons Junkanoo group who would close the event about 10 p.m. And we're making this a special occasion. We're hoping that families would come out and join the Saxons group and rush. I would be rushing along with the Saxons group. My wife will be rushing. My grandson will be rushing. And so will 8-year-old granddaughter who will be ringing bells for the first time. So I would ask many to come out and join us. It's a family event. And they would hear the Saxons group, part of the group, in preparation for their 6th straight. But Madam Speaker, I rise to make my contribution to this compendium of bills. But I will adhere specifically to the National Health Insurance specified chronic disease prescription drug fund. And I may just touch on the others, but basically I'll talk more about that. We have had a crisis of non-communicable diseases in our country for some time. And this is something that I have spoken about on numerous occasions, both as Minister of Health and as Prime Minister. And this crisis has been well detailed. As someone who has spent his career in health as a physician, I am alarmed at the state of affairs. Bahamians, Madam Speaker, are sick and dying in excessive numbers due to a series of chronic conditions that often go untreated or poorly treated. The main types of chronic non-communicable diseases are cardiovascular diseases such as heart attacks and stroke, chronic respiratory diseases such as chronic obstructive pulmonary disease, asthma, diabetes, and cancers. Our health profile is poor as a result of poor dietary choices and insufficient exercise. And Madam Speaker, that's why I want to congratulate the member for Angliston in bringing forth the National School Feeding Program. That was a program we spoke about, but I would ask her to go even further, the complete program. The intention was not only breakfast, the intention was lunch, and the intention was to include an after-school program. And that after-school program would have been academic, it would have been sports, and civic, and those were important. Academic, because you would know very well that many individuals in your constituencies and in my home and my birthplace do not have facilities to study after school or study at all. And that would allow them to receive assistance at school by professionals and at the same time complete their schoolwork. The sports program would have engaged them in active sporting activity and help with the chronic non-communicable diseases and obesity that we see. And then there was a civic program, and the civic program would bring in individuals to speak about many things: finance, savings, conflict resolutions, crime, laws, environmental matters, how important it is to respect laws, respect each other's, and whatever else. And the after-school program would have include a snack, because you cannot keep students there all day. So I would urge that you complete the program. I don't want any credit. I want a healthy nation. Madam Speaker, we have an obesity crisis, and this crisis is increasingly affecting especially our young people. We eat too many refined carbohydrates and high-fat foods and processed foods. We do not eat enough fruits and vegetables. And the prevalence of fast food restaurants in our major population centers is worsening the problem. And maybe the time we need to look at the possibility of enacting a law to ensure that no international fast food franchises are introduced, especially into our family islands. Nassau is contaminated already. Grand Bahama is already contaminated. But let us preserve the family islands, and let us take care of ourselves. If we want to bring in foods, our own restaurants. Keep the McDonald's and Burger King that get us looking fat out. Some people eat 2 or 3 meals a day from fast food restaurants. Sadly, high cholesterol, high blood pressure, and obesity are the norms in our country. We are an increasingly unwell people. We are addicted to eating foods that make us sick. This lifestyle problem places significant burdens on our healthcare system. Our clinics and hospitals are filled with people suffering from the effects of non-communicable diseases. Healthcare budgets constantly have to be increased to try to be able to keep up with the number of people suffering these conditions. There are also losses to our national productivity and economy. And chronically sick people miss days of work. And when they are at work, they are less productive due to being unwell. We have to find interventions that help our people to make better lifestyle choices. While medications are important, we must also redouble efforts with the next generation, especially to teach them better eating and lifestyle choices. Initiatives are underway in the schools related to diet and nutrition. And again, I congratulate the member for Angliston. However, we may need an even bigger and bolder effort in the schools and education system to teach young people about healthy eating and the need for lifelong exercise. While the Bahamas has one of the worst health profiles in the region on these issues, there are challenges worldwide in dealing with non-communicable diseases. The World Health Organization notes that non-communicable diseases kill at least 43 million people in 2021. In 2021, 18 million people died from a non-communicable disease before age 70. 82% of these premature deaths occurred in low and middle income countries. Of all non-communicable diseases, deaths, 73% are in low and middle income countries. Madam Speaker, the drug fund bill before us seeks to provide for the establishment of a new fund under the control and management of the National Health Insurance Authority for dispensing prescription drugs and providing medical supplies to patients with specified chronic diseases. Madam Speaker, it was the F&M government that established the drug plan in 2009 when I was Minister of Health. But there was a special component within that plan that is very dear to me. There was a component called Healthy People component, and it's still there. But it was utilized very effectively. What that component allowed, individuals could have written to National Insurance with their proposal in terms of exercise, in terms of eating, proposals of keeping individuals healthy, hoping that they would improve their lifestyles and improve the quality of life. Once these programs were accepted, they were funded by National Insurance. And Madam Speaker, they were very effective at that time. In fact, there were quite a number of proposals that were accepted, and quite a number of individuals were able to stop taking hypertensive medication and was controlled just on food and exercise, etc. A number of people were able to stop diabetic medication because they, again, were controlled just on these programs. And that was a saving in terms of medication, purchase of medication, and also a saving to the health facility. And we face overcrowding, etc. But programs like this, which had a track record of being effective, should be continued. And that was very effective when Algernon Cargill was there, I think. So I would ask the minister to look at it. I think, when I think about it, I think it would be an excellent department within the drug fund to be run by some of our world-class athletes who want to return home. That would be a great opportunity for them to run the Healthy People program, analyze it, approve it, and ensure that it is effective. You can bring many of our world-class athletes back home. These programs normally have nutritionists and different things, and you would know, it's all there. With the passage and enactment of this bill, Madam Speaker, the National Prescription Drug Plan that currently serves more than 41,000 Bahamians will be administered by the National Health Insurance Authority. And the purpose of this act are to improve the accessibility and affordability of prescription drugs and medical supplies for the treatment of specified chronic diseases, to foster collaboration with partners and stakeholders towards the implementation of a national program for dispensing prescription drugs and providing medical supplies for the treatment of specified chronic diseases, to support the development of a formulary and to support the development of a national bulk purchasing strategy for providing prescription drugs and medical supplies. The authority may enter into a contract with privately owned registered pharmacy, medical supplies company, whether privately owned or not, hospital or a clinic managed by the Ministry of Health or the Public Hospital Authority, pharmacy managed by the Ministry of Health or the Public Hospital Authority, or a licensed hospital or licensed clinic to dispense prescription drugs and provide medical supplies for the plan in accordance with the terms of a contract. I support this legislation as it will continue to assist Bahamians with chronic diseases to get the medicines they need to stay alive. These medicines are essential in helping combat the crisis of non-communicable diseases affecting so many in our country. But medicine alone, Madam Speaker, will not do the job. And that's why, just as we are debating a compendium of bills, we should have a compendium of health components. Medication, one, the Healthy People Program, two, and the National School Feeding Program, inclusive of the after-school program. I think all of them together would help with the chronic non-communicable disease, save many lives, decrease the demand on our hospitals, etc. Legislation such as this easily achieves bipartisan support as it is intended to help our people. Parliament, Madam Speaker, will need to keep a keen eye on this issue. The crisis of non-communicable diseases is ongoing. As more Bahamians are afflicted by these conditions, it will be necessary for Parliament in time to increase funding for prescription drugs to keep up with the crisis. And I think there was a bill that was tabled in this Parliament, I think in 2010, 2009, with respect to the prescription drug plan, and it was never passed, but it's something we have to look at because funding will become an essential component for the national health to succeed and survive, as well as the National Prescription Drug Plan to succeed and survive. We can talk as much as we want, but unless there's proper funding, the program, as good as it may be, will collapse. And it has to be bipartisan. It has to be agreed upon because health, education, and safety, security should not be a political matter. Madam Speaker, as we are discussing health, I must raise a health-related question to the government. You know, I couldn't just ease all through. Earlier this month, No. I said, let me repeat. Health should not be political.
Yes.
But we can discuss, we can look, and make determination as to what is best for the nation. All right? Earlier this month, the government finalized a deal with China for the specialty hospital here in New Providence. Many hoped that the government would reverse course with this project and build a new wing at Princess Margaret Hospital, which was formerly the consensus of PLP and FNM administrations. It seems, Madam Speaker, however, that this administration wants to go in another direction, and they have their reason. The proposed hospital is expected to cost $267 million. The government is borrowing $195 million from China of that total. The remaining 27% of the project cost, or $72 million plus, will be funded locally or internationally, or both, by the Ministry of Finance. The government has yet to reveal the details of this borrowing and how much this will cost taxpayers. The funding mix for this project is quite odd and begs many questions. Construction and completion of the hospital is expected to take between 31 and 36 months, and the hospital will be finished during the term of the next government. I have raised concerns about this project before in this place. Many other medical professionals are alarmed at this project for many reasons, ranging from staffing, environmental concerns, traffic flows, logistics, and other problems. One of my major concerns is the large number of Chinese workers that come with Chinese loans. With Chinese projects, China gets the general contractor and the labor. At the contract signing, the Minister of Health did not say how many Chinese workers are coming to the Bahamas as a result of this deal, even as many Bahamians still need jobs. According to the media, he said, according to the media, I have it here, we are presently at 50-50, 50% Chinese, 50% Bahamian workers. I'm quoting. And we're trying to see if we can do a bit better. But I would keep the media and the country informed on the final document of where the labor component would lie, end quote. The Chinese are very detailed. I want you to listen very carefully to this part. The Chinese are very detailed and they are very thorough in their analysis of the projects they enter into. They analyze. By now, they would know how many Chinese workers they will use on this project. Why is it that at this late stage, when deals are being signed, the Bahamian people cannot be informed of how many Chinese workers are part of the PLP's hospital project? Is it 500? I don't know. Is it 1,000? I don't know. Is it 1,500? I don't know. Maybe more, maybe less, I don't know. But contracts are usually not signed unless these things are worked out. It is unfortunate that so many foreign workers will come into the country for a public works project. Whoa, we're running out of time. We as a country have a youth unemployment rate that hovers around 20%. Our young people need jobs. Bahamian public work projects are supposed to create work for Bahamians and not others. Based on how the Chinese operate, many wonder whether the government will have to hire Bahamian workers for this project out of the second set of money they will borrow at possibly a much higher interest rate. I don't know. The Chinese loan component likely will fund Chinese contractor and the Chinese workers. Another concern many have with this project is regards who will operate the hospital. This is very important. Who will operate the hospital? And I want all Bahamans to listen carefully to this component. This is a concern that doctors and nurses have publicly shared. We have a well-documented shortage of nurses, but that's worldwide. The US is short by about 250,000 nurses. That's worldwide. We also have shortages in other medical specialists and physician specialists required to operate medical facilities. The government has not released any detailed plans anyone is aware of, declaring how we will find the necessary staff to run this hospital. Many are worried that this project will become a white elephant and will cause more problems for the healthcare systems. Many are concerned that it will draw resources away from PMH, the RAND, and clinics across the country. Another concern is that when the hospital is finished, it will sit for quite a while, not being fully utilized because we do not have all the people required to operate it. Madam Speaker, I stress that point because, and I repeat again, the clinic in Abaco, the mini hospital, was constructed at the time I was Minister of Health. The clinic in Exuma, the mini hospital, was constructed at the time I was Minister of Health. Beautiful edifice. Those clinics are not properly utilized up to the day. You may say it's an elephant. They're not utilized properly up to today. We do not have the staff for those facilities. Dental facilities in that clinic, the Abaco clinic, the Exuma clinic, were up until recently, from 2009 now, were up until recently, new dental facility, still in the plastic. Still in the plastic.
Trying to figure what that was in my head.
If we're experiencing the problem and we're building big hospital facility, we will have the same challenges. All I say is let's work together and resolve the problem. It is not your problem, Minister. It is a worldwide problem, shortage of healthcare workers. It's a worldwide problem. Let us all sit together and try to resolve the issue. Hospitals are very difficult to operate. Where will the people be found to run the hospitals? I guess you'll bring people like me out of retirement to come and run the hospital. But you know why I didn't go back into medicine? I just can deviate for 1 minute. Why I didn't go back to medicine? And we have to, no, these are facts. These are facts. We as a country are too polarized. That has to change. If I was frightened that if I went back into medicine practice, somebody can come in there because a former prime minister and a politician, somebody can come in there and accuse me of certain things so they can take headline and have in the paper that they're going to sue me and this and that. Your reputation does not worth the money that you would get. And I decided, no, my reputation is worth more to me than running that risk. But Minister, that was just a sidetrack. That was just a sidetrack. That's just a sidetrack.
That's a sidetrack. Real reason is here. That's a good point.
Madam Speaker, at the contract signing, the Prime Minister said the Bahamian people deserve a health care system that works, one that meets them where they are, and one that lifts the standard of care for everyone. And I agree. But that will only happen via this hospital if the staffing issues are worked out. Otherwise, we will have a large building that does not have the workers to run it, to make it run. This government already owes millions to healthcare workers for medicine, dialysis services, and other bills. And that's not just a problem with you, it's a problem with governments. The PLP has failed to fix major problems at PMH and throughout the healthcare system. Having already massively failed to improve healthcare for many fronts, they may be making the problem much worse. This will make the problem worse. Madam Speaker, I would stop here, but I want to say before I sit, I want to remind the public again to attend our Gambia event, participate in our Jankanu activities, and I want to remind the member for Central and South Eleuthera, we still have challenges in Kalani. We still would like our streets, especially South Ocean, to be repaired. I mean, you can refer to our road as patches, and the cars just float, just dropping in holes all over the place, and that's challenges. We want to look like Angleton one day with I-95s that are going through. I mean, I drove there, went to visit some family members. I had to look around to see if I was in Florida. This is I-95 highway. And we're having challenges, we're still having challenges in the West with voltage, low voltage fluctuation. And the low voltage will, with time, affect people's refrigerators, stoves, etc. Yeah, but I'm speaking to the government. So it's a problem. The low voltage challenge is still, generators are still popping in because generators will interpret it as electricity is off, so they're coming on. And the low voltage is a challenge there. And of course, I want to remind BPL that they had broken down the wall in South Ocean, the entrance, welcome to South Ocean, so that they could have had access to their transformer. They repaired their transformer, but the wall that they've broken down, they've left it. You must learn, if we want to become first world country, let's behave like first world country. You met my wall there, you break down my wall, repair the wall. But Madam Speaker, Kalani supports these compendium of bills. Thank you, Madam Speaker.
Thank you, Honourable Member. As Minnie.